for the masses is just commercial tripe.
Can't art be accessible without sacrificing quality?
Can't art be cognitively challenging without being
Next time on Philosophy Talk.
The trouble with a classicist?
Hey everyone, it's your host for the World Beat Show, Scott Duran, and I want you to join me every Saturday at 11 a.m., where I take you on a journey around the world and show you traditional and modern style world beat music. Music from Africa, Spain, France, Japan, China, heck, even songs and artists from the United States itself. So join me every Saturday at 11 a.m. only on the KSJE 90.9 FM.
Hi, I'm Sam Payne, host of The Appleseed, an hour filled with stories for you and your family. And we're not talking about news stories here. We're talking about fairy tales and folk tales and personal stories and family tales and even a little music from time to time. And each story could spark a memory for you that you can share with the people that you love. Hear The Appleseed every Thursday at noon, right here on the information and cultural beacon of the Four Corners, KSJE, Farmington, New Mexico.
Hi, this is Sergio Melnichenko with the Brazilian Hour. I would like to invite you to join me every week with the best and most exciting music of Brazil. Every week, right here.
Tune in the Brazilian Hour every Saturday night at 11 on KSJE Farmington. KSJE is supported by San Juan Regional Medical Center, here to meet your urgent and emergent medical needs, whether they are COVID-19 related or not. Medical emergencies happen when you least expect them. Whether it's a stroke, heart attack, illness, or injury, San Juan Regional Medical Center's caregivers are here to provide care to you and your loved ones. Find out more online at sanjuanregional.com. Monday morning, 11 minutes past 8 o'clock. Good morning, everyone. I'm Scott Michlin, and thank you for tuning in. It is November 30th. Great to have you with us at 90.9 FM over the air here in San Juan County, New Mexico, 103.3 FM over the air in Durango, Colorado, and, of course, streaming everywhere from our website at ksje.com. Welcome also to our viewers who are watching this visual radio program this morning. The video is streaming live to the KSJE Facebook page, our YouTube channel, and the KSJE Twitter account. So we're glad that you are with us no matter how you're listening or watching this morning. Coming up in the next few moments, we're going to be talking with my guests from the San Juan County Office of Emergency Management, and they're going to be talking with me a little bit about a topic called M.A.C, Multi-Agency Coordination. That is coming up in the next few moments right here on KSJE, so we hope you will stay tuned for that. Then we'll get an update, of course, at 9 a.m. on our COVID-19 Community Information Program. Megan Cullip will be joining me here in Studio A as my co-host, and we'll be talking again about some of the emergency management things that are going on with that organization, and of course getting a live update from Jeff Bourgeois, the president and CEO of San Juan Regional Medical Center. That is coming up live at 9 a.m. Our streaming platforms on Facebook, YouTube, and Twitter, and of course you can hear a rebroadcast of that on the radio this afternoon at 5:06 p.m. on KSJE. That's because on the radio at 9, it's Roving with the Arts. It's our weekday classical music program. Mick Hess is here to take us roving with the arts. Today, Mick is featuring music from Schubert on the program, and you'll hear that after the news at 9:06 on KSJE, so stay tuned for that. I want to talk a little bit about the weather forecast. It's going to be a mostly sunny day throughout the Four Corners today. We're kind of off to a chilly start right now. It is 25 degrees with bright sunshine here in Farmington. We're expecting a high of 47 today. Clear overnight with a low of 18 degrees. And then tomorrow, mostly sunny but windy on Tuesday. We could see wind gusts up to about 40 miles per hour tomorrow afternoon. And the high temperature tomorrow about 47 degrees again with an overnight low in the teens. So let me introduce my guests who are here with us us this morning, again, to talk about this multi-agency coordination. It is certainly a great representation of our community. My guest here on the program this morning, Mike Mestis, is here from the San Juan County Office of Emergency Management. Also joining us this morning is Vince Moffitt from Basin Health Companies and the Farmington Fire Chief Dave Burke. Good morning, gentlemen. Great to have you all with us this morning.
Good morning, Scott.
Good morning, Scott.
Appreciate you being here, everyone. And so let's get started. Mike Mestis, let me turn to you to get us started by, again, reminding us about the Office of Emergency Management. It is a San Juan County office, of course, and just what it is that you have been doing, certainly during this very unique and challenging year.
Well, good morning once again, Scott, and hope you had a good Thanksgiving. Same to the community. Going back to our previous discussions on emergency management and COVID, again, the emergency management is, and I steal words from Dave, is that glue that try to keep the community together. We're that multi-agency coordination group that keeps things moving forward as it relates to COVID here in San Juan County. But the reason I wanted Dave and I wanted Vince on is that it's just not San Juan County OEM. Although we have a lot of things going on and a lot of issues that face us every day, I need my team members and I need my partners to help me through it. I'm lucky because I've worked with these guys for over 20 years at the fire department, and so all I have to do is pick up that phone and say, hey, I need some help.
Very good. And, of course, we're getting a lot of help and a lot of news. Of course, things change on a daily basis, and so having these folks at the ready enables kind of our resources to kind of turn on a dime if we need them to. Is that important, Mike Mestis?
Yeah, that is correct, because we have things that face us differently every day, and I get phone calls. So if I have an issue that deals with nursing homes, home health, I can turn to Vince. I have issues with the city of Farmington because they're another large scale entity. I could turn to Dave to help me. But early on, because we faced all these issues, I turned to Vince and he said, hey, Mike, have you thought about forming the M.A.C group? And I'll turn it over to Vince so he can explain what the M.A.C group was and all the partners that we brought in so that we could help make life easier on us.
Indeed.
So Vince, go ahead.
Like a great segue to Vince Moffitt from Basin Health Companies. Vince?
Hey, good morning, Scott. Thanks, Mike. Yeah, so, I have a background in, all of us actually do, Mike and Dave and I, in incident command, which is something we use in the fire service. And after I left the fire service, we use it on a different scale, using similar concepts as a multi-agency coordination group, unified command. And basically what it does is it brings some of the key stakeholders in the incident together, because you're talking about multi-jurisdictional, multi-agencies, together as a group to help coordinate a response. All of us on the group have our own incident management teams, and we're working with the functions that we do deal with on a daily basis, but then we come together and kind of coordinate that, because we're limited on so many different things, whether it's issues of personal protective equipment or staffing, and the other thing is everything that we do has an effect on each other. So it helps bring all those pieces together, helps us coordinate a unified plan to go forward to help meet those needs. And our multi-agency coordination group, our M.A.C group, consists of City of Farmington with Chief Burke, San Juan County with Chief Vega, the ambulance, San Juan Regional Ambulance, San Juan Regional Medical Center, and that's Dr. Greenberg, who's their incident commander there, who coordinates things on their side. And we get together and we look at incidents throughout the county and throughout the state and try to help develop a plan to help address them. Most currently is helping come up with a countywide plan for the vaccination process when that vaccine comes out, so we're ready to go and can do it in a way that we're not leaving anybody out. We're basically doing the best to take care of the most people that we can.
Understood. Well,
and one thing I'd add is, a lot of people maybe, this sounds very complicated, but it is actually something that's used worldwide and nationwide, but it really is kind of hard to implement. But it was partly put into place after 9/11 and then Hurricane Katrina, and we'd learned from those large incidents. We just have never had something this large that affected so many different agencies all at once.
Interesting. And that was going to be my next question about if this is just a COVID-specific iteration or this has been around for a longer time than just 2020, is what you're saying. Chief Burke, let me turn to you.
Correct. It was part of presidential direct.
That's all right, Vince. Keep going.
I'm sorry. I think there's a lag in this thing. I'm not sure if our timing was exactly right, but what I was saying is part of Presidential Directive 5 that President Bush implemented when he started the Department of Homeland Security.
Gotcha. Very good. Thank you. And Chief Burke, let me turn to you and get your thoughts on this multi-agency coordination and just how important it is. Of course, in the fire department world, we hear a lot about mutual aid and things like that. I would imagine this is maybe along those same lines, but probably a little bit even more so. But please correct me if I'm wrong.
Well, the even more so component is any emergency requires communication, and communication is always the first thing that's going to fail. So through Mestis's office, through OEM, when this concept came up and we were able to have a formalized path for communicating, it really brought the agencies together and kept us on the same path. It allowed us to share resources. It allowed us to be more efficiently utilizing, as Vince mentioned, our finite resources throughout the community and work collaboratively to find solutions. Vince's expertise in home health and working with the nursing homes has greatly reduced the impact they were having at the beginning of the incident. Mike's constant. The thing I really want to stress out there is Mike is always working with community to enhance communication. That's his core function and his greatest strength. So when we bring these groups together, his contact list throughout the community has really been a value for the entire community, to everything from the church groups to the senior services to the Navajo Nation, everything, where we just have to pick up the phone and have a phone conversation with Mike, and he brings the resources to the table to facilitate the needs. In addition, with the National Guard and with the state government entities, everything, especially at the beginning of the event, resources were limited, and everyone was fighting for the same pot of PPE and sanitization equipment and the finite resources that were out there. And with this coordinating group, the M.A.C, the multi-agency coordinating group, where we're able to set up routine meetings, identify specific needs, and then work on solution-based discussion to start facilitating them. And having the hospital as part of the group has also allowed us to collaboratively maintain a message out to the community and keep that consistency and really utilize our resources to the greatest extent possible.
It's good to hear. And Mike Mestis, let me turn back to you a little bit about working together. That seems to be a theme that I have learned from doing this program for these many years, that agencies, individuals, politicians even here in San Juan County really seem to get the fact that we need to work together to get things done, to move the community forward. And this is kind of another example of that. And I imagine it doesn't happen in every community. Is this somewhat of a unique thing, or does it happen more often than we might think, that these multi-agencies are working together even during the COVID times or non-COVID times?
Well, I kind of think it's kind of unique to San Juan County, and I take it back to the previous emergency manager, Don Cooper, had a strong local emergency planning committee, and I took it over and I've kept it going. But like Dave said, in any disaster, any emergency, the communication aspect is the most important aspect. And when you've got people at the ready just to pick up a phone and say, hey, I need your help and this is what I can do for you, Leadership San Juan's been another place that I can pick up. I'm involved in that. I can pick up a phone since I have those contacts that I form every year. So to what Dave said, to his point, the communication aspect helps. The teamwork, the leadership up here in San Juan County is like no other. And out of necessity, Scott, because we're up here in the Four Corners, we're 3 hours from Santa Fe, 3.5 hours rather, a long ways from Albuquerque. So that helps not going to get here right away. So we've learned to take care of ourselves. And because we have that great community, it's something that's continued for years.
Very good. And Vince Moffitt, let me come back to you and ask you a little bit about the health side of this, and of course your background, as you mentioned, from your work with the fire service and now working with home health and all the other things that the Basin Health Companies does in our community. This is something, and of course your other career too, when you would go around to disasters and help in those areas around the world. This has got to given you a lot of on the ground experience, right, to deal with something like a pandemic like we're dealing with now.
Yeah, and I'll be honest, I'm not sure anybody, regardless of their level of experience and background, were prepared for what we've seen. And but I do think that luckily I had gained some experience coming into this that helped prepare us and our company, and in turn working with the other agencies help prepare them. I think the biggest thing is relationship building occurs before the disaster, and so a lot of us were not communicating. The nursing homes, for example, they were used to doing their thing on their own. So trying to build those relationships during a pandemic was a challenge. We've done a great job with trying to facilitate and kind of bridge that gap. But yeah, I think our background, we took a very aggressive stance with things that we do every day in the fire service and emergency services in regards to protecting our people and protecting those that we serve. And we just had to change that and implement it at CDC and CMS, and now like places like Mayo are coming out with additional studies on how to improve and do this better and just fine tune it to try to make sure that it's part of our everyday lives. So yeah, I felt like I was definitely in the right place at the right time for that, but it's definitely a challenge, as these gentlemen will tell you as well, and those at the hospital, and it's something that we face every day. And right now, it's kind of a weird feeling because, we really ramped this up in the beginning in the spring, and then we saw kind of a pause on everything. And now we're in a situation where it's probably worse than it ever was for anybody. And it's hard to get the public and everybody else to realize that this is definitely not over. It's a marathon, not a sprint.
That's very true. Well, and as you mentioned, the numbers are really increasing, or have been increasing. I think they're kind of leveling off maybe a little bit, knock on wood, fingers crossed, but I know we're watching those, as you all are, probably every day. Chief Burke, let me turn back to you a little bit about, again, your work with the Farmington Fire Department and coordinating with the other departments in the region, and just how important it is to have all the emergency services kind of on the same page. That's something that I think we've been talking about now for a little while, right, of moving to the incident command system and kind of trying to coordinate on a broader basis. And is this kind of going along the same lines as that?
Oh, absolutely. But I'm sorry, I'm going to step back a little bit and
Sure.
answer a question that you posted previously related to, has this happened elsewhere in the state, nation, or world?
Okay.
And everyone on this call is very, very humble and not really sharing their experiences. But Vince's component with Team Rubicon and traveling the world responding to disasters, Mike's decades of experience with community and collaboration and communication, and my engagement with some responses on the federal side of things. This is unique to San Juan County. The time, energy, and effort that's been proactively put into the Office of Emergency Management, the local Emergency Planning Commission, the relationships that have built through Mike's office over decades of development have really allowed that communication barrier to be broken to a level that from firsthand experience throughout the nation and outside of the nation, just that isn't the norm. It is so easy for people to communicate within their circle of influence and their needs on a daily basis that they often lose sight of their neighbors or their other stakeholders, and that communication breaks down. And the worst time to have a discussion is when the incident or the stress or the actions are time sensitive in nature, to make an introduction and figure out who the players are and trying to utilize the resources to the greatest financial and logistical nature of the event. So I just want to push back a little bit that, yeah, we have a very special communication path here in San Juan County that has been developed over several years and has actively had a positive benefit in our ability to handle this incident and manage it with the citizens' best interest in mind. And as I said initially, communication is always the first thing to break down, and we've got a very robust communication pathway happening now and for the duration of the event, and everything we're looking at is the sustainable responses. Obviously, there are time crucial things that we're dealing with on a daily basis, and we handle those, but we maintain the consistency and the interest of the public's perspective in mind, of everything from contact tracing for positive employees of our organizations to appropriate response guidelines to meeting the citizens' needs, and trying to work with all of our stakeholders to maintain a sustainable response to this incident. As Vince mentioned, it's not going to be a light switch. It's going to be we're in this for quite some time, and once that vaccine gets out there, hopefully the pace of operations will slow down, but we'll continue to fight the fight until the end of the pandemic is called.
Right. Well, and that's an interesting thought too, and thank you for sharing that, Chief Burke. I appreciate that, and mentioning some of those other things that you did. Mike Messis, I want to come back to you because I think some of the things that Chief Burke was mentioning, a shout out to the local governments who, of course, kind of fund a lot of the things that we're talking about, allow you to do the things that you're able to do, and allow Chief Burke to do some of the things that he's able to do, and have this coordination and put money where their mouths are to talk about improved communications throughout the county and things along that line. Is this organization, the M.A.C, going to stay together after the pandemic is ruled out? Are you going to keep everyone's numbers on file? Or because obviously, again, this is something that could come back together with a brush fire or another incident, an issue like water problems in the neighborhood, things like that. What's the plan post-COVID?
Yeah, Scott. Well, hopefully post-COVID will hurry up and show itself for us. But yeah, the M.A.C group is, like Vincent stated earlier, it's something that's always been there, and you form it when it's needed. Again, multi-agency coordination group. So because we have a pandemic going on, we needed to form it. So we'll use it. We'll continue to use it. And I won't take all the credit. I have my coordinator, Allie. She facilitates the M.A.C group for all these guys, and it just frees me up. And going back, these guys are real humble, and they don't like to pat themselves on the back. But when I can pick up a phone and say, hey, Vince, I'm having issues with home health and nursing, and for him to drop everything from running his company and come and set up an emergency support function and help with assessments and PPE and all kinds of other things that nursing homes and home health needs, just to take that off my plate. That's going back to that brotherhood in the fire service. And the same thing with Chief Burke. When I can call him and I said, hey, I have a homeless population issue and I need help with a COVID shelter. And for him to drop everything that he's doing with with the fire service and his organization and the city of Farmington to help us with COVID shelters. I mean, I just can't speak enough to the brotherhood, and that goes back to that fire service where I can just pick up a phone and say, hey, I need help. And that goes as far as Dr. Greenberg at the hospital, to Ruth at the hospital, to Deputy Chief Tracy at the police department, at Farmington Police. All that help is there. And again, these guys are humble, but because of what they do, it makes me look good.
Well, there you go. Well, I think you're all very humble, and for a resident of San Juan County, I appreciate it, and I think everyone else does too. And a lot of folks, I don't think, realize a lot of the work that we're talking about this morning that is going on kind of behind the scenes. We hear a lot about the COVID numbers and the cases and the word about the vaccine, which we're all certainly anticipating. But I don't know if folks realize that, we do have shelters for COVID positive patients who maybe can't go back with their families or need a place to stay separate from other folks in their immediate family, and some of the other untold stories. I know there are dozens, if not hundreds of them that have been happening throughout this entire year in our local community that all of you have had a hand in. And Vince Moffitt, maybe you know more than the rest of us kind of how this is dealing with at the home front, right? When your folks are going out and still visiting with patients in their homes and taking every precaution that you can to still get services and important information and maybe medicine to your clients.
Yeah, I think a lot of people didn't know that what home health actually was and how the impact that we have for the healthcare in the community to keep people. I mean, our whole goal is to help keep people out of the hospital. It's something we work with on a regular basis, and through COVID, it's especially important. I mean, it puts stresses on the emergency services through San Juan County or City of Farmington. It puts stresses on the hospital, which really is a linchpin for all of this. As they get overwhelmed, somebody's got to continue to care for the health of the community and other aspects too. And our big push is just prevention, because we're dealing with the most vulnerable, and if we can keep the most vulnerable safe, then we're having an impact there. And so, really pushing the prevention thing, mask and hand washing and staying home if you are very vulnerable, but you still need help. You still need someone to care for whatever your medical problems are, or things like even taking care of feeding and grocery shopping and things like that on an everyday basis. It is big. And I think that, there's different aspects of this that people, when they sit at their home and they're watching the news or they're watching TV, they don't know it's happening outside of their home. If COVID hasn't affected them yet, they haven't necessarily seen it. But anybody who works in healthcare right now, whether it's emergency services or the hospital, or the services that myself and some of my competitors do, they know that COVID is super real. I mean, it is happening right now in this community. And so we're just going to keep on trucking regardless of maybe some of the unknowns that people have. And just to your point too, when we're meeting, I mean, this group, and we're starting to meet more often now. We're meeting twice a week at this point, but early on in the spring, we're meeting every day. Mike also has stakeholder calls with all the schools and the city leaders and county leaders, businesses that can come on, and we can all kind of give a sit rep of where we're at and what we're doing. And Mike can gather all the information, and we take it to the MAC group, and we work accordingly. And, I think it's really a testament to the community, regardless of the political side and what's really happening in our other lives, coming together and trying to do our best to have the impact, even though it doesn't necessarily affect just me, it affects everybody.
Very true, and I appreciate that. And Mike Mestis, we just have a couple of minutes remaining this morning. I want to come back to you a little bit. You mentioned maybe the next thing that you all will be working on is coordinating the vaccine. We are certainly hearing news about that every day, it seems, with approvals and New Mexico being chosen as maybe one of the first 4 states for one of the companies to roll out its vaccine. And so can you share anything with our audiences this morning, Mike Mestis, about how that vaccine distribution is going to work, or is that still a plan that you are building as we speak?
Yeah, Scott, I can share a little bit about that. And it goes back to the planning group, and it's quite ironic that Vince and Dave and Dr. Greenberger are part of that planning group. We have another core. It's not the MAC group. We have another core planning group. But we've been planning for the last month or so, and we have another meeting tomorrow. And it all depends on when that vaccine is going to come out. So we have a plan. We have a location. We have a number of facilities that we have designated that we'd like to get the vaccine to. But that first phase is for healthcare workers at the hospital. And so that's what our first plan is. Our biggest caveat to it is the freezer space. And we think that we've got that solved with the Department of Health, allowing a freezer up here for our health office so that we can have that vaccine. Again, you're hearing on the news all the stuff that's coming out on it is just there's going to be limited amounts. So we'll get what we get. We'll get that out, and we'll get it to our tiers and keep fighting for what we can get here in San Juan County.
Very good. Well, I appreciate that, and we're looking forward to it, of course. And final thoughts from each one of you. Again, as I mentioned, numbers have been increasing. They may be leveling off just a little bit, at least temporarily. We hope that they go back down. The state has certainly unveiled a new county-by-county plan for some of the reopenings and less restrictions as things do hopefully calm back down. Can I come to each one of you and just ask for your words of advice to the public as we move through the holiday season, and we're out of Thanksgiving now and people are thinking about Christmas and New Year's? Dave Burke at the fire department, what are your final thoughts here to our audiences this morning?
Well, my thoughts are, I completely understand everyone is COVID tired, and everybody has been dealing with this for almost a full year at this point, and it's a struggle to maintain the concepts that are the proven impactors on the spread between masks, social distancing, hand hygiene, and avoiding gatherings. As we potentially transition into more openings within the community, I just ask for people to maintain the smart actions. Wash your hands frequently, use sanitization products, wear masks, and avoid areas where you're going to be in close proximity to others. We just went through a holiday season, and without a doubt, there were people at the gatherings that had COVID. So if you had a large gathering, please avoid large groups. Please avoid or please wear your masks. There is CDC documentation to say how that impacts the rate of spread. It really kind of needs to be, I don't want to call it a new norm, but people just need to maintain their situational awareness and continue to facilitate those proven mechanisms to prevent the spread in our community. We get to a point where the hospital's overrun, or we get to a point where there's significant community spread, it's going to be more and more difficult to make an impact, and then it's going to start impacting our ability to provide services, and then it's just going to escalate from there. So really, I don't want to be doom and gloom. All I want to say is please continue to be smart in your daily activity, and that will help us help maintain services within the community and facilitate a transition until we get that vaccine out there.
Very good. Thank you very much, Chief Burke. And Vince Moffitt from Basin Health Companies, I want to come to you. Kind of same question, and I know with your background, and certainly you've probably got some good words of advice for us all as well.
Yeah, I think that, from the very beginning, I don't envy anybody that's making these decisions, whether it's a governor in our state or any other state. They're doing it all around the world. Everybody's taking a slightly different stance on how they implement these, but they all involve the same thing. Economic, slowdown or shut down, the masks, the hand washing, all these things. So, you either did too much or you didn't do enough. No one's ever going to say we did the right amount. And so unfortunately, we're at the mercy of where we live and what those restrictions are. And I would just say, hey, there's three things we got to worry about. One, we need to get the economy going. How can we do that? Well, one of the things we can do is slow the spread. And I think mask and hand washing definitely has something to do with that. I think the other thing is we've got to maintain our workforce. And right now, with the amount of testing that's going on and everything else, we're seeing a lot of spread, which means more quarantine of employees, more quarantine of people, and that's affecting us. So we got to slow that down so we can keep our workforce intact. And I think, you know, the last thing really is taking these steps. I mean, none of us like them, and we find different ways of how we engage with that. But we know that, you know, the Mayo Clinic just released information this weekend on mask and the efficiency of mask and things like that. I know from our standpoint in the workplace, they have helped us stop spread or slow spread down. So, you know, it just makes sense to me if we have high numbers that we need to actually kind of think about that so we can get people back in the workforce and we can get these businesses back open. So just be careful, be safe, and remember that this is really happening, and those are things that can have an impact that we have control over in our community.
Good point. I appreciate it. Thank you very much. And Mike Mestis, you'll get the final word this morning from the Office of Emergency Management about what we should continue to be doing to stay safe and keep our neighbors and friends safe as well. Oh, we're not hearing you, Mike. Maybe you're muted.
There we go.
There,
hey,
right. Yes, sir.
Sorry about that. Hey, what can I share with what's not been shared by Vince and Dave? If it's something as simple as wearing a mask and washing your hands, what have you got to lose? If you think about it, you can save your own life by wearing a simple mask, washing your hands, and social distancing, and the simple thing of staying home and not going to congregate places with friends and relatives. Then what do you got to lose? So with that, again, thank you, and thanks for having us on and allowing us to share our collaboration and what we've been doing here in San Juan County. And thank you, Scott, for helping get the word out and continuing these shows to spread the word.
Well, you're very welcome. That's what we do here at KSJE, and we appreciate it. And again, thank you, gentlemen, all of you, for the work that you continue to do together and separately to keep our communities safe. Thanks for joining me this morning, all of you.
Thanks, Scott.
Thanks, Scott. Have a good day.
All right. You're welcome. Thank you, everybody. Again, my guests, Mike Mestis from the San Juan Office of Emergency Management, Vince Moffitt from Basin Health Companies, and Dave Burke, the fire chief with the city of Farmington, here with me on KSJE. I'll be back with more in just a moment, everyone. The time is 8:46.
I'm Tracy K. Smith, and this is The Slowdown. Love, peace, passion, communion with others and with everything, freedom, grace, praise, play, song, surprise, escape, transcendence, digging in deep. Why are we here? What do you believe in? Right now, my conscious thought and a tremendous wellspring of feeling are focused upon celebrating and protecting Blackness.